Okay, so now we're moving on to the abdominal inspection. So first I'm just gonna observe your stomach, looking for any like bruising, any scars, any birthmarks or freckles, especially looking for any bumps or anything that could indicate like a hernia. If I did see a bump, then I could have you look the other way and give me a good cough. And that could help me determine if it's intramural or something deeper. And I would palpate it later, but that would interrupt with some of your bowel sounds. So first I'm gonna go ahead and take a listen to all the quadrants of your stomach. Is there a spot in your stomach that hurts at all? The lower left one? So I'll start there. And I'm gonna listen to each quadrant for 5 to 15 seconds, listening for the normal bowel sounds. If I don't hear any for 2 minutes, then it would be considered to have absent bowel sounds. Which these sound good. And I would do these last two for 5 to 15 seconds, but just for time's sake, I'm going to skip it. And while I'm auscultating, I can switch to the bell and listen over the liver for any friction rubs. So I could just have you breathe in and out normally, and I'll be listening for like a leathery sound, which isn't there. And I can do the same thing with the spleen. Sorry, my hands are cold. Which would be in like the last 2 ribs. And that's fine. So now I can listen to, for bruits, starting with your abdominal aorta, moving over to the renals, just lateral to the umbilicus. And then the iliac arteries, iliac arteries, in between the belly button and the ASIS. And lastly, the femoral arteries. So I'm just going to roll the top of your pants down a little bit. And compare that to the other side. Okay, and that is good. So next I'm going to move on to percussion. So I'm going to just do a general percussion starting at like the axillary line. Feeling for any unusual non-resident sounds. They should be pretty hollow. And next I can find the general thing of the liver by going from the belly button up. It's right about there. And then from up in the ribs down. Going from hollow to more dull. And that should be about 6 to 12 inches, which that's good. And I can also check for the spleen, which you shouldn't be able to. And it's nice and hollow, so that's good. Next I can palpate. So I'm just going to start off superficially palpating each quadrant for any lumps or bumps, making sure if I do feel any that they're not hard, or make sure that they're movable. Maybe ask the patient if she's felt them before or has had them. Sorry. Okay, and then next I can go with the deeper palpation. So I'm gonna. Sorry, does that hurt?
Yeah.
It tickles.
Oh, it hurts.
It hurts. So I'd feel for the ascending colon, transverse, and then the descending, down into the sigmoid colon, and that all seems pretty good. And then I'm gonna palpate for your abdominal aorta pulse. Let me know if the pressure is too much. So there it is. And I'm gonna make sure it's not too big. It should be only about 3 centimeters, which that's good. And then next I'm gonna palpate for the liver. So to do this, I'm gonna come from the top and palpate the bottom of the ribs. And then have you take a deep breath in and exhale. As you exhale, I'm gonna follow down and feel for any hard nodules in your liver, which is good. And the next one, I can try to feel for the spleen. So in order to do this, I have to reach behind you. And I'm gonna try and kind of pinch the spleen in between my 2 fingers. Which I can't feel it, which is good, because you're not supposed to be able to. And then I can feel for the kidney while I'm here. And then the kidney on this side. Okay, just relax. Okay. And then lastly, I can check for McBurdy's point right over here. I can push down on it and feel like a reflex. So did that hurt anywhere when I did that? Over the spot only? And I can try that on the other side. Did that still hurt at all? Just on the same spot. Okay, and then some special tests we can do. I can check your obturator by having you put your leg up and just let me do all this work. And just internally and externally rotate. And do you feel any pain in any of your abdomen with that? Nope. And then lastly, can I have you lean facing the wall on your side? And then just go ahead and move this leg straight and then try and move it back as far as you can. Any pain with any of that? Nope. Okay. Good. And that is the abdominal exam.